Acral lentiginous melanoma. Definition: acral lentiginous melanoma are the last common variant of radiograph-based melanomas, comprising fewer than 5% of all melanomas. They arise most commonly on palmar, plantar, sublingual, and occasionally mucosal surface. The acral lentiginous subtype is the most common type of malignant melanoma among ancient and dark-skinned individuals, with a particular predilection for the soles of the feet. Acral lentiginous melanoma in Hawaii.
Melanoma in Hawaii, and doing that to join us is Dr. Shane Morita. He is a surgical oncologist from the Queens Cancer Center, the University of Hawaii. Aloha, thanks for being with us. So this is some pretty interesting work that you're doing. Please tell us about your poster.
Sure, it's on acral lentiginous melanoma in Hawaii, looking at a non-Caucasian population, as well as a unique, somewhat novel pathway called the mTOR signaling cascade. Now, this is a form of melanoma which has nothing to do with sun exposure. Right, this type of melanoma, which Bob Marley died of in 1981, is felt to not have any pathogenesis related to sun exposure.
What does it have to do with?
You know, genes, I think people are trying to elucidate this a little bit further, but genes are probably involved, and inflammation, trauma.
How did you design this study?
Well, being in Hawaii, we have a multi-ethnic population, and as this type of melanoma tends to be seen in non-Caucasians, we felt that we had a unique access to this type of tumor. And we looked at this pathway that is getting a lot of attention, called mTOR.
And what were the results you achieved?
We found that the mTOR pathway was seen in over 50% of these patients with acral lentiginous melanoma. And in the future, this potentially can help in designing therapeutic trials.
Sublingual melanoma arises from the nail matrix and usually present as a longitudinal brown or black band, with or without nail dystrophy. The involvement of the proximal nail folds, Hutchinson's scent, is considered a clue to the diagnosis. Sometimes the presentation is that of a sublingual mass, with or without pigmentation, with various degrees of ulceration and nail plate destruction, onychodystrophy. Acral lentiginous type melanoma.
Well, hello there, internet friends and family. Today is Monday, October 12th, 2015. I'm home, working from home today. Got the kids right here. So there's Pumpkins, Harley. Let's see if I can get Harley on here. There's a Harley girl. There she is. So, so today I'm working on getting a second opinion, getting some additional information about my melanoma, my skin graft. So I did call the University of Arizona Skin Cancer Institute this morning, gave them kind of the brief summary of my history, and they had to refer my information onto the patient coordinator of the dermatologist who I would be seeing, who's the expert in melanoma cancers. And I have not heard anything back from them today. They said sometimes they actually call the dermatologist and get the records before they even...
Not all melanomas arising in acral site are acral lentiginous melanoma. Four histologic patterns may be seen in melanomas arising on the acral surface. Acral lentiginous melanoma, nodular melanoma, superficial spreading melanoma, and an unclassified type. In a histology study of 62 cases of plantar melanoma from Japan, 14% were classified as nodular melanoma and 30% of superficial spreading melanoma. Acral melanoma.
Graz, Austria. In the second part of acral lesion, I want to show you melanomas. Many of the acral melanomas are also easy to diagnose clinically, and of course also in dermoscopy they display all the features of melanomas on other body sites. Here is another example of an easy to diagnose melanoma on acral side. It's important to recognize melanoma in earlier stages, and here is an example of a large macule on the sole where it's not so easy to come to a diagnosis. So we have to remember a little bit again the anatomy of the glabrous skin. We have the ridges and in between the furrows. And it's important to know that the furrows are smaller than the ridges. This is important because one of the most important pattern
Clinically, an acral lentiginous melanoma appears as a dark brown to black, unevenly pigmented patch. Arrest of regression manifests as foci of bright white discoloration. If a lesion becomes raised or develops ulceration, the likelihood of invasion should be considered. Risk factor for melanoma.
What increases anybody's risk for melanoma is some of the risk factors. A lot of intense sun exposure at an early young age. Those people that are more at risk for skin burning, such as the fair skin people, blonde hair, blue eye, very, very fair skin. If you burned a lot when you were young, even with very little sun exposure, that's a concern. That's definitely a concern.
However, some tumors that invade along the periacrine and ventral dermis may appear flat clinical events if they have encroached upon subcutaneous adipose tissue. Thank you for your attention.